Welcome to the International Association for Adolescent Health Pioneers Project. In this series, we have interviewed a range of experts from around the world who have led the way in promoting adolescent health in their countries, regions, or internationally. We wanted to listen to their stories and share their experiences so that these might be applied elsewhere. The members of the IAAH Education Committee were particularly interested in how these pioneers influenced the education and training of healthcare professionals in adolescent health. In the following interview, Dr. Kirsten Boysen is interviewing Dr. Kristina Berg Kelly, a pioneer in adolescent health in Sweden.
My name is Kirsten Boysen. I'm a Danish pediatrician with a specialist interest and experience in adolescent medicine, and I'm a member of the Educational Committee at the International Association for Adolescent Health. I have the great pleasure and honor of introducing Dr. Kristina Berg Kelly, a true pioneer and a great inspiration in the field of adolescent health in Sweden, in the Nordic countries, and in Europe. Kristina has a PhD and is a pediatrician by training. She spent a year in the US at the UCSF in specialist training in adolescent medicine, and she served as an associate professor and senior consultant of pediatrics at Drottning Silvias Children's Hospital in Gothenburg. Furthermore, she served as many years as an independent consultant in adolescent health and medicine. Kristina founded the Swedish Association for Adolescent Health in 1987 and is a co-founder of EuTEACH, specializing in effective training in adolescent care and health. Kristina has held numerous courses and trainings in Sweden and international, including through the EuTEACH and WHO, and she has served as an important mentor for both Swedish and North Nordic young professionals. I myself experienced the Swedish specialist course in 2008, which was a true eye-opener, fantastic inspiration for both clinical work and staff training, and it was a lot of fun. Kristina has received the IAAH Founders Award in 2021 for her devotion to promoting young people's health and her pioneering work in establishing the field of adolescent medicine. Dear Kristina, thank you so much for sharing your experience with us. So, being a pioneer, you've been witness to many changes in the field of adolescent health. Can you please share with us a history of how adolescent health evolved in Sweden and in the Nordic countries?
Well, I was interested in adolescent health basically because I have 3 sons and 1 daughter. And when they were, in the puberty, the girls, my daughter could go to what we call youth clinics, which was basically for girls in Sweden and for contraceptive advice. But there was nothing similar for boys. And I had 3 boys. So I was wondering, where should I send them to get some professional advice for young men? And there was nothing at that time. So by chance, I was able to go to the United States in 1981, and I looked at the pediatric papers available at the hospital, and there was about 10 different courses on neonatal diseases and premature infants. But eventually I found one on adolescent health. And this one was in San Francisco for 1 year. My husband comes from Los Angeles, so he wanted to go to Los Angeles, but he could be persuaded to go to San Francisco instead. So I signed up for that course. And about 1 month later, I heard a thick American voice asking for my name and asking whether I could come for an interview. And I said, yes, where, how? Well, this man said, I'm Charles Irvin from San Francisco. You have applied for a job with me. I am in Oslo now. Could you come here now? Well, Oslo is about a couple of hours by airplane or bus. It's not so far from where I lived. So I said, but this was in the afternoon. I can't come now, but I can be there tomorrow. Well, tomorrow morning I am in Stockholm. Well, I can be in Stockholm tomorrow. And so that happened. Next day I met him in old town of Stockholm, and we had a long talk and had lots of fun. And so I was accepted for this scholarship in San Francisco. So that was my training for 1 year, and it was really an eye opener in every way. I had only my own, experience with my own children and their friends. But here you could learn a professional way of talking to young people. But what I could add to that clinic was my medical professional knowledge, because they know how to talk to adolescents and what their problems were and advise them about sex, but they know nothing about allergy and diabetes and things like that. And all the patients they had in that clinic in San Francisco also had all kinds of diseases like that. So I could add my professional pediatric knowledge to them, and they gave me their adolescent professional knowledge on how to deal with adolescents. The training was for 1 year, and lots of hands-on, talking to adolescents, advising them, etc. So this was the background I had when I came back to Sweden. What then happened in Sweden was that there was a lots of interest in what is adolescent health and can you teach us something and what can we learn. So after a month or so, I arranged a week-long weekend course for people from the west part of Sweden who were interested in this. We went to what is called People's High School. This is a Danish thing, so you would know from Denmark what it is. And that place was not used during the weekend. So we could stay there fairly cheap and work. We started Friday early. We worked, had lessons up to 10 o'clock at night. We started next morning at 7. And this school didn't serve breakfast until 9, but no complaints. We worked all day Saturday to 10 o'clock and started 7 o'clock on Sunday. And then at about 3 o'clock, we all had to leave. But people were very enthusiastic and nobody complained. Everybody worked hard. And I was thinking, how can I capitalize on this interest? So at that time, we decided right away to start a group of, to start an association for adolescent health on the west coast of Sweden. And arrange some meetings. What then happened was that the Pediatric Association in Sweden found out about that, and I was invited to speak about it, describe it, etc. And from then on, it sort of rolled forward by itself, no problem really. It grew and grew by itself. People were enthusiastic, and other categories like midwives joined us and child psychiatrists, etc. So it kept growing in Sweden, and I think from then on, I don't remember how it was spread to the Scandinavian countries, but I know that there was also adolescent health going on in Europe. What actually happened was that there were a few people who had trained also abroad on other parts of the world, Australia, Canada, United States. And this guy, Pierre-André from Switzerland, collected all of us, and we formed a European association, which was very professional in making courses, he had pedagogical consultants come in and advise us what was a good way of making courses, etc. Well, now it's up to you to ask questions, I think.
Yeah, so it sounds like a fairy tale, but with a happy ending because, well, I think in Sweden you are still really working on adolescent health and medicine. Did you find any challenges or how did you, any troubles that you had to overcome, but was it just easygoing in Sweden?
Well, I think everybody was very positive.
Yeah,
I think the only ones might be the midwives because they had sort of monopoly
yeah.
on teaching girls about sexual reproductive health in Sweden. Uh, so we had to walk very carefully around them and invite them to teach parts that were adequate for them to teach. But I think they sort of felt professionally sort of threatened. But
Oh,
then they also realized that we had a much broader scope than what they had. So basically, it was not a big problem, I think.
yeah, fantastic. And maybe it was also because of you. You have kind of this nice approach. You're not aggressive, so maybe you had a big finger in the fairy tale.
Well, I don't know. I think my key way of working with this, besides teaching, was also that the participants should have fun.
Yeah,
We should enjoy ourselves. We should
yeah,
have fun,
yeah.
which is I think is also very important. And we did crazy things in the beginning. We arranged one course way up in Sweden, you know, in Jämtland, halfway up to the North Pole. Uh, Over the weekend there, somebody arranged for us to stay in a small bread and breakfast place, and the people there said that they had never had people coming for conferences at that place where people started to work at 7 o'clock in the morning and worked till midnight, which was what we did.
Yeah.
But the last day, Sunday, we took off at around noon and started to walk around the mountains. And all of a sudden, it started to snow. And before we knew it, we had snow up to our ankles and
Oh,
no shoes for that. So things like that happen.
yeah, great. Do you have any good advice or guidelines for training workforce of health professionals? Some practical steps or the process that you followed?
Uh, Yes, I think you should. I think number one is that you know your material. You are well. You know adolescent health, the basic. You have to have a textbook, if nothing else, to check on. So what you teach, that you really know what you're talking about. And if you when you get into fields where you are not really professional, like you know sexual reproductive health and all this advice, you have to bring in them, and also child psychiatry or adolescent psychiatry for serious mental disorders. You should bring in the professional people. And also, I think the other thing is you should know where you have your friends
Oh, yeah,
in the field. Whom of the professional people in those associated fields in your country can you approach, and who would like to work with you on that? I think that's also very important, because if they are your friends and if you know them, it's much easier to handle, you know, problems that always come up, you know.
yeah. Did you have you involved any organizations or government departments in your work, or was it just kind of person to person, or the friends as you call them?
Uh, well, I think school health, you know, different organizations like school health departments and similar departments were interested in what we were doing, but more on the basis of us coming there to give courses to them, and that was never any problems of they were sort of asking for us to come and give courses. Uh, I think that the midwives who were used to be sort of the star in the field with sexual reproductive health for girls, they somehow felt that we were taking over. But on the other hand, they also realized that our scope was much wider than what they had. And we were also always very careful to bring them in any area that touched on where they were the professional stars, if you know what I mean.
Yeah, yeah. So this started in the early 90s.
The 1980s.
Yeah. How has adolescent medicine and health involved in Sweden and in the Scandinavian or Nordic countries?
Well, when we first started and took it up, it was just courses that randomly ran courses. But as time went by, people wanted to have it as part of the professional training for future pediatricians. And of course, that was kind of hard to get through because first we had to have enough teachers to do that for future pediatricians to get a scope of adolescent health. And also we wanted, nurses and teachers to get, at least some lectures. So we had to train ourselves to be good teachers to take up that. And also to be paid, Sometimes people expected us to come just for fun. And in the long run, you can't do that. So there used to be some sort of problems of getting adequate pay for what we were doing, but not really much. I think people wanted to learn about, the basics of development, psychological development during those years, and how to, what problems were important for young people and how you could help them. But also, I think most how you speak to them. So, I mean, this was gradually coming everywhere, and now it's sort of part of the curriculum, but that is something we had to work for to get it into the training for pediatric specialists, for instance, took quite some years. I think it was like 2010 or something. We got it into the curriculum for future pediatricians, for instance.
Yeah. And how did you succeed? What was your trick?
Sorry?
What was your trick to get it in the pediatric curriculum?
Well, at that time, I had some very good co-workers and who had, somebody knows somebody knows somebody, and that person can speak for it. And those people in the government and those areas were more willing to listen. But also they realized that this was something that was coming everywhere.
Yeah.
So it took some time, but the problem is that there is only so much money for training of future pediatricians, for instance. So some other fields have to cut down on their training in order to allocate money for the training in adolescent health, for instance, because they didn't want to give us more hours to teach adolescent health in the specialist training for future pediatricians, for instance. So it was sort of a wheeling and dealing, and not so easy always.
Yeah. No. Do you have some recommendations, like 3 essential key points or topics for training?
Oh, that was a hard one. I think number one is that you know the stuff that you're going to teach thoroughly, and that you have practiced or prepared and have good overheads, which are and have had them maybe criticized by outsiders. Have to go through with some professional pedagogical training to get your material very professional. I think that's number one. And besides that, I think, like I said earlier, the one thing is to make sure that people have fun when they train, And you're not too Yeah, that's right. I mean, to have to make sure that you're not overbearing with your teaching, that you allow for breaks when you see people are tired,
Yeah.
and of course, one thing that we always try to do, which was hard when many times, was to get young people there to for some part, especially if you were not on your home place, you know.
Yeah. Yeah. So involving young people in the training.
Yes,
Yeah.
not having them constantly, but
Yeah.
having them there to be interviewed, for instance.
Yeah. Yeah.
Well, I think that you have to have your material scrutinized by outsiders who can tell you if it makes sense, including the overheads material you have. And then I also think it's very good to give people some paper to bring home. You know, some basic key points on adolescent development psychologically and adolescent growth. I mean, normal data on that, and also some basic data. How many adolescents do you have in different age groups in your country, and where do they get their medical support, etc. And of course, it's very good if you have some sort of a questionnaire with young people. I mean, you can even take, if you, as I worked with school health, you could ask them how pleased they are with school health, and that's always impresses people if you can bring some basic data uh, on what adolescents think and want. You know, that works very well. You know, this is what adolescents wants to hear from
Yeah.
their doctor.
And you did do some questionnaire studies in Sweden, right?
Yes.
Yeah.
I was basically, you know, I worked in Switzerland, and I also know from the United States that they had all these different kind of questionnaires. And after we had been doing basic training of ourselves and enough co-workers for about 10 years, we decided to make a general questionnaire for adolescents in Sweden. And of course, it's kind of hard to get money from that sort of thing. But at that time, there were enough school health physicians who were interested in national adolescent health, and we met together and took out a questionnaire with about 150 different questions, stolen often from other places and adapted to Swedish circumstances. What was good about that was that then the school health physicians could go back to their own area and go to the managers and those who have the money and say, this is what we want to do. Look at this questionnaire. This is interesting. And of course, if their own school health physician came there with a questionnaire, it was easier for them to put money into that. It's always hard to get money for national scope questionnaires, but now we had questionnaires similar for all over Sweden with the same kind of questions, and everybody finance it by going to their own area, the economic responsible person in their own area, and show it. And that was effective. It worked. We got the money and we got the question.
Yeah.
I think altogether over the years, I have something like 30,000 questionnaires collected, but you know,
Yeah.
that's, and, you know, we have put in questions like, have you ever been so unhappy and depressed that you considered taking your life? Nobody ever asked adolescents things like that. That was really shocking.
Yeah.
So in some areas it was called the suicide question. But that was 1 out of 150 questions, you know.
Yeah. Yeah.
But that was a way of also showing that kids who said that they were depressed, those were the ones who didn't like school and had nobody to talk to. So it was by having all these questions together, you could using all these fantastic computer stuff that there is now, and find out who were the ones who said that they were depressed and wanted to commit suicide. Then, of course, you could put the torch onto something much more important. You know, these were the ones that were lonely and didn't like school and things like that. So you could sort of work broad scope, more broad with that kind of question. You know.
Could you please share your vision for adolescent health and training the workforce in the future?
Well, I think that this should be part of pediatric training very early when people train for pediatrics. But I also think that a scope, a slice of it should get into you know, all doctors who train, all people who train to become doctors, they should hear about adolescent health as part of their general orientation that they get early on. And same with nurses. There should always be a slice of adolescent health and that there is something like that in the scope early on so that they then could pick up if they are interested and find more knowledge eventually. It should not come at the end, you know, as some very strange specialist thing that you need. It should be presented just like you present how do general practitioners work and how do, you know, all this general. Like public health is also something that should come early on. Public health, including public health for adolescents, for instance.
Great. Do you have any final comments? Something you really need to say as a pioneer?
Well, I say what I started by saying. People should have fun when they train and work with adolescents. And I think basically, if you have that attitude, it will come by itself. And that will help training, you know. It should not be so damn serious. And of course it is serious, but you should make sure that they have fun and that they enjoy it, you know.
Great. That's a good final comment. Have fun. Yeah. Yeah. So,
Okay.
Kristina, thank you so much. It's been.
I hope this is of some help.
It is. Thank you so much.
Okay. Thank you to
Yeah.
both of you
Yeah.
for bearing with me.